Even though I don't think of myself as a poor person, I know when it comes to the figures and what are the most important things, I'm actually at poverty level. And so this helps me be able to maintain some degree of pride in coming here and being treated so very well.
You know, it makes me feel like I'm in the right place, that I can both take care of everyday problems for people and also every now and then something that would have slipped through the cracks otherwise, or a patient that might not have come to medical attention until they were very desperately ill. And that's a good feeling, you know, that's what I trained for.
These are our neighbors. These are people who live in our community, who have needs that they can't pay for. This is loving your neighbor as yourself, treating someone else as you would like to be treated.
At the RotaCare Clinic of Mountain View, we're committed to making a difference in the health of our community. Our mission is clear: to bring free medical care for the relief of pain and suffering to those who have the greatest need and the least access to medical care. El Camino Hospital Foundation, in collaboration with local organizations, created the RotaCare Clinic in 1996 in response to growing healthcare needs in the community.
One reason that Mountain View is the size that it is because it's so involved with the hospital. The hospital really got involved in this clinic and allowed it to grow to a larger size than some of the others.
This clinic is the flagship of the RotaCare Clinics, and I think without the help of El Camino Hospital, El Camino Foundation, this dream would have never become a reality.
Although the Bay Area is one of the wealthiest communities in the world, many people, including the working poor and the temporarily unemployed, are uninsured and live without adequate health care.
This particular clinic provides an extraordinarily important service, and that includes a place where people who don't have access and who don't have the income can afford to be seen by practitioners, are cared for in a way that helps them to not only get appropriate medical care, but helps them to establish some place where someone knows who they are, what their medical history is, and what kinds of things they need care for.
This RotaCare Clinic is the way healthcare was meant to be. It is healthcare at its purest and finest, and it allows us to perform excellent standard of care medicine and ensure that our skills are utilized effectively, not just for the, let's call them elite, who have the ability to pay, but in fact offer healthcare to the entire community.
It's just a remarkable program. I couldn't ask for more. Hopefully someday I'll be able to get back to work and get my own insurance, but right now without these guys I don't know where I'd be.
While reducing the costs of using hospital emergency rooms for primary care, the RotaCare Clinic provides management of episodic and chronic illness, as well as preventive services to those in need.
When we first started, we're more like an urgent care. And people would come to us with colds or flus or an injured arm, and we'd try to help them out with that particular problem. We were seeing patients that have diabetes, that have asthma, that have hypertension, that were not being managed. No one was taking care of this. And so we came together and say, how can we provide what we call chronic care management? How can we provide for their ongoing health? Because that is clearly a need.
More than just getting care for my specific problem, diabetes, the doctor I work with, Natalia, she recognized the breadth and scope of diabetes. So she got me a dermatologist. She's sending me to the eye clinic for an exam. So she's looking at the total problem as opposed to just, here, take some medication and come back the next time. And so that means a lot to me.
These are often people who might not have other outlets for good primary care facilities, that they might be going to the emergency room with something serious that we can prevent if we can follow them.
The RotaCare Clinic truly is a volunteer-driven organization. More than 150 volunteers are drawn from the community and from the exceptional medical centers in the area. Together, they volunteer their time and expertise in providing the highest level of quality health care.
I think RotaCare has the right approach in that they have nurses who do some of the follow-up for diabetes care. They have diabetes nurse educators. They have hypertension follow-up where the physician does not necessarily have to see the patient. It can be done by allied health professionals. So In order to get the continuity of care, I think RotaCare has the right approach.
It's not just about taking care of what's going wrong with you at the time. They're actually like good friends and counselors. It's about finding out the problem and making sure that they're really doing their job to make it work for you.
All our providers and volunteers believe that these patients should be treated like any patient anywhere else, and I think they feel that difference. They're treated with great respect from the minute they walk into the clinic and they're registered through the time they've waited and walked off with their pharmaceuticals.
So this is a unique model, and it's the model I'm particularly proud of because it really is serving more of the whole patient. It's really taking care of the unmet need. And when you have patients coming back in as a follow-up, and they understand their diabetes now, and their blood sugars are better, and they're taking care of themselves better, that's where you really think you made a difference.
The volunteers at the RotaCare Clinic say they find their efforts professionally satisfying and personally rewarding. They truly believe they're making a very real difference in the health and well-being of our community.
They all come with one thing that ties them together, and that one thing is that they care about people. And this is the kind of medicine that a lot of us who are in the medical field want to practice.
Without our volunteers, there's no clinic. It's pure and simple. We need these very dedicated, amazingly giving individuals to make this clinic work.
I can finish my day job and be completely exhausted. And I can drive over here to RotaCare not being sure if I have enough energy to see even one more patient. As soon as I walk in, the energy of RotaCare is there and it sort of fills you up. And I actually will end up leaving more awake, more alert, more energetic, even if I've seen another 6 or 7 or 8 or 9 patients. So the fact that it's so rejuvenating to just come here and be here with people that all want to be here, they're here for the same reason, to make a difference, to help the community. And that gives you energy.
After a while, you begin to realize that, hey, I'm getting more out of this than I'm giving. And so that bothers you for a period of time, and then you come to the conclusion, it's okay. You know, you're doing a service, you are realizing benefit, and everybody comes out on top, so to speak.
There is an esprit de corps that exists here that you don't find everywhere. You sense a real interest in the patients and commitment on the part of the staff, which is just remarkable and makes it a really pleasant place.
To continue pursuing its mission of service, the RotaCare Clinic of Mountain View depends on volunteers and financial support from the community it serves. RotaCare is proud to have excellent partnerships between El Camino Hospital Foundation, RotaCare Bay Area, medical groups, medical foundations, Rotary clubs, volunteers, local donors, corporation grants, and local restaurants. Because of your generous contributions, RotaCare Clinic can continue to help make a difference in the health of our community.
RotaCare Clinic depends on 2 things to stay in operation. The first is certainly volunteers. Without the doctors and the nurses, they would be nowhere. But the second is to have enough funding to actually pay for the core staff that administers the clinic and for drugs and other capabilities that the clinic needs.
We are trying to synchronize the growth. We want to get more providers in here, but when you get more physicians volunteering, you have to make sure you have more support staff. And when that arrives, you have to make sure you've got enough diagnostic support, x-ray support, laboratory support for the increased patient volume.
There are many good places to give donations. The religion of your choice, AIDS, homeless, hundreds of different organizations. What touches me and what I invite you to do is to come down to the clinic and see where your money goes. Look at the people, know that they're being served and helped and your money is doing some good. Whether you write a check, whether you come down and help, whether you're one of the restaurants to donate food for the staff. People who know about this program really like giving to it.